It's a pleasure to be with you all. Unfortunately, I was not able to be there in person due to some traveling conflicts. My wife and I both work for AdventHealth, and it's great to be with you. And sometimes our travel gets a little crazy, but I'm here to present on a research paper that I wrote with a couple colleagues from one from Clemson University and the other from Virginia Commonwealth University. I'm going to explain to you a little bit about that research. It has been published in the Journal of Healthcare Chaplaincy, and I can send you all a copy of that article if that's of interest and you email me. But really, what I want to do is extrapolate those findings specifically for the context of Adventist health systems and how that looks specifically in the U.S. healthcare system, but obviously it can extrapolate beyond that within for chaplaincy, right? So, chaplains in transition, workforce implications for Adventist healthcare, and we'll start here with just a question. Um, Think about this as I talk through these slides. If Adventist healthcare continues to expand spiritual care services, where will the next generation of chaplains come from? Um, think about this as we talk about these next several slides. So this workforce analysis was done within AdventHealth. For those of you who are not familiar, AdventHealth is a healthcare system that is owned and operated out of Altamont Springs. It is affiliated with the Seventh-day Adventist Church, and situated very specifically within that are chaplains, at least in the Florida area. They are hired through the Florida Conference of Seventh-day Adventists. So this paper, when writing about this, I kept it generic, and of course, kept it as a kind of a system level understanding. How can we track? How can we understand hiring, attrition, those type things within this paper? But for this presentation, it's exciting to be able to apply that specifically within the SDA context. So it was a secondary data analysis, so it's retrospective, but it was over 12-year period. And essentially, what we were able to do within our health system is understand what our clinical chaplain hiring process was over that time period. So we have at AdventHealth aggressively hired, aggressively acquired hospitals, and we always get this question from CEOs: how many chaplains do we need to cover this campus? And we don't really have a great answer for that. So in order to develop that, to gather some data on what we're doing, how we're doing it, and then some of the things that we might be able to do better, we did this study over a 12-year period, and we specifically got the data from the Florida Conference of SDAs, who tracks that for AdventHealth within the Florida system. So of the findings, these are the three major findings that we found. 129 clinical chaplains were hired over that 12-year period. That is a lot of chaplains, if you're not familiar with chaplains within the healthcare landscape. The chaplain workforce at AdventHealth grew 85% during that same time period. Think about that. From the last 12 years, it's actually was 2024 data to 2012. That is a lot of growth. However, 36.4% of cumulative attrition, right? So growth occurred, but attrition increasingly offset those gains. What does that mean? Well, the greatest threat is supply. So at AdventHealth, and I can't speak for the other health systems, but AdventHealth, all of our chaplains are SDA ministers. And so this creates, with our other health systems, this tax on supply, right? So hospitals continue hiring chaplains. Also, they continue growing, right? Our health system. So AdventHealth has been growing at an increasing rate over the last several years. But that net workforce growth is essentially the amount of chaplains that we're hiring minus the amount of chaplains that we're losing. It's slowing, right? And attrition is increasing. So in that study, there were 17 individuals in that 12-year period that were hired that were working at or past the US average retirement age. So you're thinking 17 individuals of those 129, you go from staffing issue to staffing crisis very quickly should all of them exercise their ability to retire, right? So attrition may represent the greatest threat to spiritual care quality and sustainability. That was the biggest finding of this study, was that 36% of those individuals who joined in that 12-year were not retained. That doesn't mean they didn't stay in chaplaincy. It just means they didn't stay in chaplaincy at AdventHealth. And so one of the greatest findings was, if we are going to create a sustainable workforce to answer that research question, how do we keep, or how do we hire enough chaplains to provide quality spiritual care for our system? How are we going to keep the chaplains that we have? And that's an important piece to that puzzle. So what does this mean for SDA health systems, right? This is just 4 that are listed. And I know that this is a conference that reaches a worldwide audience. But AdventHealth, Adventist Health, Kettering Health, Loma Linda Health, there's other independent institutions, right? But all 4 systems employ chaplains, and they emphasize whole person care. Whole person care has been an initiative that is not just within the Adventist system, but healthcare in general. I've recently done some research within the VA, and whole person care is a part of their language, right? So it has become a universal staple, tending to the whole person, looking out for spirituality and emotional needs as well as health needs. But all of these systems, they depend on specialized spiritual care professionals within chaplaincy. And they face succession planning challenges. How are we going to replace the leaders of today? And then how are we going to retain, right, the chaplains that we need from prior years, right? So the question is not whether chaplains are valuable. In fact, some of my research within our health system and other health systems has shown that inherently staff and certain stakeholder groups find value in chaplaincy, but it's whether enough qualified chaplains will be available to meet future demands. Similar to many healthcare professions, if you haven't known this or are not aware of it, in the next 10 years, we will see drastic shortages within healthcare landscape, not just nurses, which we have been pressured in the last several years, but with physicians as well. And then, of course, my concern with spiritual care and my chaplaincy background is this very thing. How are we going to ensure quality spiritual care is provided within the healthcare system if we struggle to supply the needs we already have going into the future with those planned retirements coming up? So one of the areas that affects supply, right, is the educational pipeline. And we have different areas that have contributed to this. But for those of you who are not familiar with clinical chaplains, I want to just demonstrate to you the amount of training that a clinical chaplain exhibits, right? So they have some type of MDiv or Masters of Science equivalent, right? The literature there for accreditation is 72 hours and above, right, of theological training. So there's some Masters of Science, like the Masters of Science in Spiritual Care at AdventHealth, that meet that requirement. But essentially, you have masters trained individuals, not unlike pastors. But unlike pastors, chaplains will then go through something called clinical pastoral education, which is around 1,600 hours of specialized training. Each one of those units of CPE, there's 4 that are represented in that 1,600. It has 100 educational hours and 300 practical or practicum hours of patient to clinician face-to-face contact. So you are in depth specialized training with your CPE. Once you have those 4 units, you are eligible for full-time employment. So you have that specialized training, you have your theological education, and now you're ready to be employed as a full-time chaplain. However, the desired state for most individuals and what they say that they want hired is a board certified chaplain, so after you're employed, you need 2,000 hours worth of experience, and then you need to go through this board certification process. that process, there's different institutions that have board certification. We have Adventist Chaplaincy Ministries, that's one of them, but there's also an external body, the Association of Professional Chaplains, that also provides that, where you have to meet upwards of 29 competencies in written and verbal defense. And it is a grueling process as one who's gone through it, but it's very useful for the ministry of a clinical chaplain. So this just kind of gives you an idea of that specialized training that clinical chaplains have. And then it also shows when you're asking that specialized training of chaplains coming through the ranks, it's harder to find those qualified chaplains than you might be able to find pastors, right? So it's a smaller pool. And then you're struggling with the growth on the other side of the health system, right? So this study focuses on supply and retention, but educational institutions are where supply begins, right? So looking at these different programs that can contribute there, and understanding how we can work together. So some of these recommendations of what can we do. Well, this paper directly shows the usefulness of forecasting, data tracking, understanding what hiring looks like within your system. What we found with our trends over the last 12 years is AdventHealth is reactive in their hiring in the ministry space instead of strategic. And that's not necessarily an overwhelming critique. It's natural, right? When you lose someone, you fill the position. That's human nature. But when you can see the data over a span of 12 years, and you can look at the potential of, oh, well, we dipped in this year. When you see it from the 10,000-foot view, you can understand how you might move pieces that you wouldn't have thought about if you were just responding to an immediate need, right? So we tracked attrition. One of the things that I would suggest that we do is we track reason for leaving. That's one of the things. We saw that 36% attrition rate. And guess what? AdventHealth came to us, the research team, and they said, listen, why are people leaving? And I had to look at them and say, well, I don't know. Your data doesn't collect that, right? So it's a data limitation. So asking reason for leaving, possibly doing an exit interview, right, to gather some more robust data within that scope. But we know, based on healthcare literature and the tax on resources, is that retirements in the next 10 years, it's going to lead to shortages, and chaplaincy is not in a place that is protected from that, right? And then I think another piece that we can speak to is strengthen academic partnerships. There's these health systems that are sharing in our mission of delivering quality care and spiritual care. And in order to do that well, chaplaincy plays an important role, especially in whole person care. So having alignment between those health systems, understanding of this corporate need to fill these spaces is going to be very important. That also extends to those academic partnerships, right? Whether it's CPE centers or graduate programs within those different programs. How many graduates do we have? And what does that look like as the pipeline going forward? So that leads to that last point, right? Which is today's resident becomes tomorrow's staff chaplain. So just a couple questions to end, right? Are SDA health systems proactively planning for chaplain shortages, and how can health systems and universities collaborate to strengthen the pipeline? So if chaplaincy is central to whole person care, which I believe it is, workforce development must become a strategic priority rather than an afterthought. And it can be as easy. In that paper, we demonstrate some data initiatives. It can be as easy as just how many people do you hire, how many people do you lose on a yearly basis, and track that over time. And of course, you can add some of those things that were recommended. But specifically looking for how are we maintaining the quality required of spiritual care across our health systems, and making sure that we are representing that mission component that we have, that we borrow from the church, that we extend within our health systems, of extending the healing ministry of Christ, especially at AdventHealth. How do we show that in a very real way through the spiritual care that we provide? Um, and that is the conclusion of my presentation with regard to workforce analysis and spiritual care at AdventHealth.